Hi, I'm Hailee Clark, and I'm a second-year graduate student in the Speech-Language Pathology program at Illinois State University. What is speech-language pathology? I'm going to tell you that shortly, but first I want to tell you why I created this video. Out of over 300 million individuals in America, about 40% are minorities. We are such an increasingly diverse population. However, in the field of speech language pathology, out of about 181,000 SLPs, only about 31,000 are minorities. Out of those numbers, only about 5,000 are African American. That is less than 0.04%. So, what all these numbers are telling you is this profession is lacking diversity. We need to increase that number to keep up with the growing diversity in our country. Diversity is defined as showing a great deal of variety or being very different. Workforce environments that are more receptive to diversity are needed. Workforce diversity will create changes that support more innovative thinking, promote the unique strengths of individuals, and build strong relationships among peers. This will also create environments of respect, compassion, and openness, along with more inclusion of minorities and non-minorities. This change is needed because speech language pathologists serve such a diverse population. As a graduate student, I haven't had any mentors of my own culture. Having a mentor of my own culture would have given me a more fulfilling experience, as well as making me a more confident graduate clinician in my program. Universities are working hard towards making diversity a priority. However, the number of minorities with doctorate degrees in the communication sciences and disorders programs is still disproportionately small. With that being said, there's also a need for more minority mentors and faculty to guide and support graduate students in the field of communication sciences and disorders to succeed in graduating and any other goals that they are aiming towards.
Hi, I'm Brianna Rivera Thompson, and I am a second-year graduate student at Illinois State University, getting my master's in speech-language pathology.
Hi, my name is Chastity Liddell, and I am a speech-language pathologist.
Hello, my name is Brianna Chambers, and I am a second-year graduate student at Illinois State University.
Hi, my name is Makari Hewitson, and I am in the Communication Sciences and Disorders Master's Program at Illinois State University, and I am in my second year of the graduate program.
Hello, my name is Deja. I attend Illinois State University in Normal, Illinois, and I am in the Masters of Science Speech Language Pathology program.
Hello there. My name is Karen Whitfield, and I am a speech-language pathologist in coastal Virginia.
Hello everyone, my name is Janae. I'm currently a speech-language pathology grad student here at Illinois State University.
Hi everyone, my name is Liz Jones, and I'm a first-year student at Illinois State University in the Speech and Language Pathology Master's Program.
Hello, my name is Nicole Mason.
Practicing in the field of speech-language pathology for 5 years.
Hi, I am Samantha Washington. I am a speech-language pathologist that has been practicing for about 13 years.
So, what is a speech-language pathologist? A speech-language pathologist is a professional who is involved with communication and swallowing across the lifespan. When talking about communication, we are talking about speech production, fluency of the speech, the language used to produce the message, cognition, voice and resonance, and even hearing. And when talking about swallowing, we're not only talking about the actual swallow, but also the feeding behaviors that are involved.
What do you love about the field of speech pathology? I feel like it is such a rewarding experience. You're making a difference in someone's life, and I'm helping someone get their voice, the voice that we all deserve. And it's such an award to be able to be that core person in someone's life.
What I love most about the field of speech-language pathology is the variety we get. We can work in a variety of settings with a variety of clients, so I really like how there's so much variance within this field. I also love how we get to help people improve their speech, language, and communication abilities.
The best word I could use to describe my job is joy, because there's a lot of joy in what I do, and I actually like to see the joy on my patients' faces as they continue to get better each and every day.
I love is that I'm giving someone the tools to be a better speaker, to communicate their thoughts better. Just the little things like that. I feel like if you speak well, you could get so far in life. And it makes me feel good that I'm giving someone those tools, those strategies, just to get far in life. To be successful, whether you believe or not, you have to know how to communicate well. That's the number one to me. So I'm really glad that I can help people with that.
Something that I love about the field of speech-language pathology is that you can work and be involved and make a difference in so many different sectors of the workforce. So for example, you can work in a school. You can be a school SLP. You can work in a medical facility, including inpatient, outpatient, acute care. You can work in a skilled nursing facility. You can be a travel SLP. I love the fact that in this field, there's just so many different routes you can take, and you're never really stuck in one. If you get tired of working in the school, or if you get tired of working in the hospital, you can always choose a different setting. And I just think that's such an awesome option to have, because not a lot of jobs have that much flexibility and variability in it.
What do I love the most about being an SLP? I would say there are two primary things that I love the most. One is making a difference in the patient's lives. It is very rewarding to see a child who is struggling to communicate or struggling in school, and then to start working with them and see that the things that you're doing is making a difference in different aspects of their life. That is very rewarding. The second thing is empowering parents. Parents rely on us once we start serving their kids to make that difference. And at times they can feel hopeless, and that it could be up to us or someone else to teach their child what they know.
The reason I love the field of speech language pathology is just because it's a perfect combination of teaching and psychology, because that's kind of where my interests fall. I was either going to be a teacher or a psychologist, and this is just a perfect mix between therapy and teaching. And I also love that we get to treat people of the entire lifespan. I feel like that's super unique to our field, and so that's awesome.
I like the autonomy in the field. I like that we're pretty much our own boss in a plethora of settings. And not only that, but I like that we have an unlimited amount of opportunities. For example, we can work in hospitals, nursing homes, schools, private practice, home health. So the opportunities are endless, and I enjoy that about the field.
What I love most about being an SLP, there are so many things that I could say. Number one, I love kids, period. I enjoy working with them. It can be stressful, especially when you're talking about children who have difficulty communicating. But I think the biggest thing for me is just seeing the happiness that it brings when you help them learn how to communicate. And I don't think I can ever forget how it feels when you have a family who's so appreciative of everything that you've done for their family. There's just nothing in the world that can beat how happy a parent is when they finally hear their child say mama or daddy, or when they finally hear them say they want something to drink, or just any type of way that they can communicate. There's just no feeling like it in the world.
Where and with who do speech-language pathologists work? Speech-language pathologists work across many settings and work with individuals of all ages, cultures, and disabilities.
I work in a school setting. I service K through 5 students. I see students with articulation, and receptive and expressive language disorders. I also see kids who have stuttering disorders, or a stuttering disorder, so we call it fluency. Um, I have a few students on the autism spectrum. I also see a couple walk-in students, so they will be preschool level but speech only, typically phono at that level.
I started out as a speech pathologist in coastal Virginia at a trauma 4 hospital, acute care speech pathology. Well, I've done probably over 20 years of acute care speech pathology and a combined 25 years of inpatient outpatient, which now I am primarily outpatient speech pathologist serving all the needs of this area, mostly neurologic or Parkinson's patients, and I see voice patients as well.
I currently work at Harbor Valley Rehab in San Antonio, Texas. At Harbor Valley Rehab, I work with those who have been diagnosed with CVAs, Parkinson's disease, dementia, cognitive declines, encephalopathy, things of that nature.
Is an assistant professor at Southeast Missouri State University. There I teach courses related to multicultural topics in communication sciences and disorders, craniofacial anomalies, and resonance disorders, and I also supervise teletherapy sessions.
I have just come upon my 4th year this month, October. I've been working for a pediatric population private practice clinic for this entire 4 years. I did my clinical externship with this company, and they decided they wanted to hire me straight on afterwards. Within that population, we typically see children between the ages of, I think the youngest has been 15 months, and the oldest I've ever had has been a 16-year-old. On my current caseload, I have mostly children who are language and artic, but I also have a few who have disfluency disorders. I also have several children with apraxia. I've had one for feeding, but we don't get feeding very often. And let's see, I'm trying to think if I'm missing anyone. The majority also is children who have autism, which of course, language comes as a secondary disorder to the autism a lot of times.
Yes, speech-language pathologists are found across many various settings. These settings include educational and healthcare settings. Some examples of educational settings are preschools through high school, colleges and university, and early intervention. Some healthcare examples are hospitals, inpatient and outpatient, acute care, rehabilitation, NICUs, nursing homes, residential and non-residential healthcare facilities, and even private practices.
Right now, my typical workday consists of getting up and recording lectures to post to my Canvas page. The courses that I teach this semester are online, so I record my lectures and post them in Canvas for my clinicians and students to watch. I grade papers. I'm on several different committees at the department and college level, so that kind of varies week to week on whether I have meetings or not. And then of course I'm reviewing paperwork for my clinicians, supervising their sessions throughout the week. Kind of just varies on what's going on depending on what day it is.
I work 4 9-hour days. So I work 9.5 hours a day for a 36-hour week, and I see 12 patients in that 9-hour day. So my day is very busy. And I can start anywhere. My 8 o'clock patient this morning was dysarthric from a stroke. My 4 o'clock patient that just canceled was dysphagia from a stroke. And my last patient that I'm going to see in a few minutes is dysphagia from dementia, and she's slowly forgetting how to do certain things. She's coming in with a caregiver. So I'm actually going to be giving most of the information to the caregiver so that she can help her mother, which is an elderly lady, how to have the best quality to her life.
A typical work day looks like me seeing like small groups of kids, so like 2 to 3. Sometimes I have groups of 4, mainly about 3 kids. My office is very small at one of my schools, so I can only fit about 3 kids in there. So I see groups of, yeah, 3 to 4, sometimes individual. Like I said, I see them for 20 to 30 minutes at a time. If they're younger, like kindergarten, I try to do 15-minute sessions. Or if I could test students all day, I would. If I could just give like language assessments, that is really what I like to do.
I get to work at about 7:30, 8 o'clock in the morning to see patients eat breakfast. And I usually go from table to table, review strategies, make sure patients are tolerating their food safely. And after that, I usually go back to the therapy room and type some notes. Then I go see my patients who may have cognitive difficulties or the ones who receive cognitive treatment. And then I go to lunch. Well, I go to their lunch, watch my other patients eat lunch. And after that, I just complete paperwork throughout the day. Like that can be progress notes. I can be typing evals.
My typical work day, I see about currently 10 to as many as 16 clients. We're kind of down right now because of everything going on with COVID. But within those 10 to 15 or 16 children, we do 30-minute sessions with each of the children. We see them one-on-one individually, and then we speak to the parents about how they did during the session once the 30-minute session is over.
Speech-language pathologists serve the community in many different ways. Including collaboration with other professionals, counseling, prevention and wellness, providing screenings and assessments, implementing treatments and therapies, the use of different modalities, technology and instrumentation, and working with different populations and systems.
I obtained my master's degree from Illinois State University. I also got my undergraduate degree there.
I graduated from Hampton University in 1991 and again in 1997 with a degree in communicative sciences and disorders.
I got my master's degree at the University of Central Missouri, UCM, in Warrensburg. That was in speech-language pathology, of course. I got my doctorate of education through Walden University, and I got that in special education. Since at that time I was working in the public schools, and I had my undergrad and grad in communication sciences and disorders, I wanted to do something just a little bit different, but still related to the field in what I was doing. So I decided to get my doctorate in special education, and it's worked out really well. I feel like it filled in some of the gaps for me as a practitioner.
My undergraduate degree is in speech-language pathology, actually, and I attended the University of West Georgia. For my master's degree, I went to Valdosta State University, where I obtained a degree in communication sciences and disorders.
I worked as a special education teacher for 3.5 years before I became a speech-language pathologist. I obtained my bachelor's degree at Methodist University from Fayetteville, North Carolina. I went to several different schools to obtain my bachelor's degree because I was in the military for 10 years of my life, and I would have to transfer from different schools until I was finally able to complete my degree. When I was in the military, I worked as a medical technician, which is actually where I learned about speech-language pathology. But of course, I couldn't find schools that had a program for speech-language pathology. And I ended up going into education first and later found a school that had an online program for me to be able to get my master's degree. And my master's degree is, of course, in communication science and disorders, and that was obtained through Western Kentucky University, and I did the entire program online. The only exception to this program is that you do have to come your final year of school for about 6 weeks during the summer, and you actually do classes within the actual building, and they start preparing you for actual field work that you're going to find independently out on your own in whatever state that you live in.
To become a speech-language pathologist, you would first obtain your bachelor's degree in communication sciences and disorders, or in a related field. If your bachelor's degree is not in communication sciences and disorders, then you would just take the additional prerequisite courses that are required to apply for a master's program. You will then complete your master's degree in speech-language pathology. Upon completion of your master's degree, you will obtain your 3 Cs, or your Certificate of Clinical Competence in Speech-Language Pathology. If you would like to further your education, there are also doctoral programs in speech-language pathology. Throughout your undergraduate and graduate program, you will take various courses, such as Anatomy of Speech, Language, and Hearing, Introduction to Audiology, Stuttering, Speech and Hearing Science, Spoken and Written Language Development, Introduction to Neurogenic Disorders, Language and Cognition, Phonetics, the Voice and its Disorders, and the Clinical Process, Evaluation, and Treatment.
For a student who is entering into the Communication Sciences and Disorders program, also known as CSD, in their collegiate career, I would advise that you become involved in the student organizations that the program has to offer. A popular organization is known as NISLA, which stands for the National Student Speech, Language, and Hearing Association. I would also advise that you make connections with your professors and, more importantly, with your peers, whom you will likely have many classes with. But most importantly, remember to be positive and enjoy the journey. Thank you.
Advice for a prospective CSD student is just to stay organized and chunk your responsibilities into manageable tasks.
Don't be afraid to switch things up, to try a different method of studying or try a different method of scheduling, things like that. I totally was so anti-digital before the pandemic, and now I use like my online calendar and my online planner and just all these different things that I thought I would never do, and it was so uncomfortable at first. But now I'm just completely using it all the time. So don't be afraid of difference, because difference can be good and you never know what you really can benefit from.
I would say to make sure you are in the right mental state, because mental state is everything. Like I said, it can be draining if you make it draining. So you really have to prioritize, set out, oh, I'm going to do this at this time, this day. It's all about planning. You have to really think about the future. Like, live the moment too, but the future is the main thing you have to think about, so you can get your goals done, get your, everything accomplished, and stay on the right track.
Never give up. Never give up. God has a way of working his magic, and it's gonna give you some bumps in the roads. You're gonna cry probably a little bit. You're gonna want to give up. But if this is what you truly want to do, please do not give up.
My biggest advice to anyone that's coming in this field now would be to be patient, be observant, and be productive.
Just have an open mind and don't limit yourself as to where you're going to work when you finish.
Just having the mindset that it's not a have to do it, but that you want to do it. You should want to learn and to expand your knowledge or further your knowledge in an area, especially because things are changing, research is changing, the needs are changing. So always be willing and wanting to learn. Also, something you can expect is to be resourceful. Depending on where you're at, you might be the only SLP in your district. You might be the only SLP in your hospital. You may not have other SLPs to pull from, or to connect with within your immediate environment. But know that there are several groups out there that you can reach out to. There are several websites and organizations that you can be a part of that have various resources that you will need. So I would say that you can expect to be a lifelong learner and to be resourceful.
A prospective CSD student can expect a challenging career. I think I have been in this field for a long time, and I still do love it. And I love that you have the ability to constantly learn. So it's not one of those positions where you you learn something and it just stays like static. Most of our theories are static, but things are constantly changing. So I like that. There's always something new research. So that's exciting for me. And you constantly get to learn and try different things and working with the little kids. And if you work in a school setting, you get summers off. So that's a plus. That's that's up there for me too. I love my summers off.
Simply expect the unexpected. And when I say that, I basically mean no matter what your intentions are, no matter how good you think that, or how well you think you're doing with trying to help a child, or how much good you're trying to accomplish, sometimes it's not received that way. There are a lot of parents who may feel like your way is not the right way. They may feel like your advice is not warranted, especially being a person of color. A lot of times we're not received in the same way that our Caucasian counterparts are reciprocated or received, excuse me. I know when I first started, I had some difficulty with several of my families because it was kind of like, oh, we don't really want to see the African American therapist. And it was like I had to prove myself a lot more than others did. But once my work started to show for itself, a lot more people were like, hey, this girl really knows what she's doing. She's on to something.
Hope this video will help encourage someone else that's coming into the field. It's a wonderful field to be in, but it's also a very challenging field as well. Thank you, and God bless.
I am leaving you today with all of this great advice, along with great resources for prospective students into the Communication Sciences and Disorders program. I am also leaving my personal contact information along with the contact information for some of the other SLPs featured in this video. In conclusion, being an African American student, I am committed to serve, advocate, and fill the demand for minority populations. I am motivated to pursue a career in speech-language pathology because of my desire to help others that may not be equipped to help themselves. There is a critical demand for speech-language pathologists to serve an increasing amount of diverse children and adults in the United States. By 2050, almost half the population will be minorities. In order to address the unique communication and swallowing needs of multicultural at-risk populations, I have been in pursuit of a career in speech-language pathology, and so should you.